This film has been specially produced by your local physiotherapy team at Bolton Foundation Trust. We are a friendly and professional team who are experts in the treatment and assessment of back pain. We know that it is important to get the correct advice about your back pain early, either by your GP or by your physio, as what you do about your back pain early on is usually more important than the actual diagnosis.
An attack of back pain can be alarming and severe, but this can be exacerbated by anxiety and stress.
So, try to stay calm and let's look at some of the facts. Serious or permanent damage is rare. Most back pain is not due to any serious disease. Acute pain will usually improve within days, and this means that the long-term outlook is good.
Sometimes the aches and pains can last quite a long time, and we can't predict when they're going to get better. It's important that most people remain active and try to return to normal activities as soon as possible. Your back is designed for movement. The sooner you can get your back moving, the sooner you get back to normal levels of activity, which means the sooner the recovery. Sometimes you may feel that your back is too severe with pain. In these cases, do what you can do and gradually build up your levels until you get back to your normal levels of activity.
Most back pains are simple and termed simple mechanical back pain. 60% of the population will have back pain at some point in their life. Once back pain has begun, you've got a high risk of back pain recurring. 85% of those who suffer from back pain will have back pain again. However, there are things that you can do to help. So if you have back pain, what do you do when it's in the acute phase, when it's really severe? Well, the important thing is to stay active. Don't treat your symptoms with rest. Try to move about gradually and as much as you can, building up slowly, to eventually maybe beginning a paced walking programme at your own pace, but trying to increase very gradually so that you're looking in stages at increasing your fitness. It's important to use medication to help you to be more active, and paracetamol is one of the most underestimated drugs for back pain. But it's important that you use it as prescribed, that you use it regularly to keep your pain under control. Don't use it more than 8 tablets a day. Relaxation's important. So we know that if you have any stress or anxiety, it can increase the pain that we feel. But it's all right to use resting positions to ease the pain, and do feel reassurance from what we're telling you.
We see these people doing movement and exercise. They all have lower back pain and find that doing exercise gently at first and then harder as the weeks go by has improved their condition, mood, movement, and reduced their back pain to a more manageable level. Next, we'll listen to some guidance from someone who's been in your shoes.
I have had back trouble for a long time, but in January it went particularly worse, so I then went to see the doctor who referred me to physio.
Okay, what kind of physical state were you in before coming to physio?
Almost bent double, difficulty walking.
What were you expecting from physiotherapy?
I suppose a cure, but obviously on being realistic, you're not going to get a cure.
Before starting, what were your initial thoughts and feelings about exercising?
I've done walking and that's about it, no real physical exercise. The exercises have certainly made me freer and I can walk farther. At the end of it, there's a feeling of euphoria. There's a feel-good factor inside. It really does work.
So in the subacute phase, as it's getting a little bit better, it's important that you begin to look at the rest of your life. So you might need to modify your lifestyle. Many of us are very active anyway, but you need to begin to really improve your fitness and look at something that you like to do. It might be more of a walking programme, it might be going to the gym, but you need to begin to increase what you do and fit it into your lifestyle. Hurt doesn't always mean harm, and we know that when you start to exercise, your backache might increase a little bit. This needs to be tolerable, but it's not done any harm. It's all right to increase your back pain a little bit. Importantly, try to stay at work. even if it's modified duties. You don't have to be pain-free to go back to work, but try to get back to normal as soon as you can. The majority of patients get better with this type of approach. Many don't need treatment, and there are treatments out there that don't have a lasting effect. There's weak evidence or even no evidence for things like acupuncture, TENS, bed rest, corsets and traction. Some may give short-term relief, but no long-term relief. In very few cases, there might be something more serious going on. Things to look out for are difficulty passing urine, numbness around the genitals or back passage, numbness, pins and needles or weakness in both legs, or indeed unsteadiness on your legs. If you do, in rare events, suffer from these, you need to seek medical help urgently. If you've got severe back pain which continues to get worse over several weeks, if you're feeling unwell in conjunction with your back pain, or if you're being treated for cancer at the time that you develop back pain, again seek help. So I want you to remember, most back pain is simple mechanical but not serious. Most back pain gets better with an active approach and modifying your lifestyle so that you're looking at your back pain being managed for the rest of your life. It really works. Have a go.
Top tips. Do stay active. Do take painkillers if needed. Do try to have a relaxed state of mind. Do use your legs when lifting something heavy. Do keep a good posture. Do believe you can help yourself. Do accept reassurance that you don't have a serious injury or damage.
Don't wear a corset. Don't take to the bed for a prolonged rest. Don't think you will become disabled. Don't become withdrawn. Don't become afraid. And don't become depressed. And remember, flare-ups are normal. Keep moving and keep active.